What does a high PSA mean? If you just got a blood test back and your PSA is elevated, your mind probably goes straight to one thing, and that would be cancer. But here's the truth that most people do not understand. An elevated PSA does not automatically mean you have prostate cancer. In fact, most of the time, it does not. Hi, my name is Dr. Lamia Gabal, and I'm a board-certified urologist practicing in Southern California. I want to break this down in a way that actually makes sense so you know exactly what's going on within your body and what to do next. First, what is PSA and why does it matter? Well, PSA stands for prostate-specific antigen, and it's a protein made by the prostate gland. Every man has it. A simple blood test measures how much of this protein is in your bloodstream. Here's the key point. PSA is specific to the prostate, but it is not specific to cancer. That means anything that affects the prostate can actually raise your PSA, not just cancer. So what's considered a high PSA? Well, there's no single number that automatically means that something is wrong. Traditionally, we've used a cutoff of about 4 nanograms per ml in the United States, but that number isn't perfect. We know that PSA can naturally increase with age because the prostate gets bigger over time. So what's normal for a 40-year-old is not the same as what's normal for a 70-year-old. For example, a PSA of less than 2.5 would be normal if you're in your 50s, while a PSA closer to 6.5 could still be considered within range for a man who's in his 80s. This is why a high PSA is not just about the number, it's about your age, your baseline, and your overall risk. Now, here's the part that surprises most people. Most high PSA levels are not actually cancer. There's several very common non-cancerous reasons that your PSA can go up. The most common cause is an enlarged prostate, also called benign prostatic hyperplasia or BPH. This alone accounts for a large portion of PSA elevations. Another big one is prostatitis, which is inflammation or infection of the prostate. This can spike PSA levels significantly. Even everyday things can temporarily raise your PSA, like recent ejaculation, intense exercise like cycling where the bicycle seat hits the prostate, urinary retention, or even certain medical procedures can all cause a bump. So if your PSA is high, it does not mean something dangerous is happening. It means that your prostate is likely reacting to something. But what about cancer risk? Well, this is where things get a little more nuanced. PSA is not a yes or no test. It's a risk marker. The higher the PSA, the higher the probability of prostate cancer, but it's never 100%. If your PSA is under 4, there's actually still about a 15% chance of finding cancer. And that's why we also recommend a digital rectal exam for your annual screening. If your PSA is between 4 and 10, the risk rises to about 25 to 30%. If it's above 10, the risk becomes significantly higher, with more than 60% of men having cancer. And here's another important detail. Even when cancer is present, not all prostate cancers are dangerous. Some forms grow so slowly that they never cause harm. So what happens if your PSA is high? This is where a lot of people make a mistake. They think that a high PSA means that you immediately need a biopsy, and this isn't really how modern medicine works anymore. The first step is almost always to repeat the test. In about 25 to 40% of men, we find that that number goes back to normal. Then your doctor might look for other causes like an infection or recent activity that could have affected the results. If the PSA is still elevated, then the next step might be an MRI versus proceeding with a biopsy. The MRI is called a multiparametric MRI, and it helps identify whether there are any suspicious areas, but the MRI itself also isn't perfect, which is why sometimes we will go straight to biopsy. There are also advanced blood and urine tests that can better estimate your cancer risk before a biopsy. If there's strong concern after all of those initial steps, your doctor may then move forward with a biopsy. And here's the bottom line that many people miss. A high PSA is not a diagnosis. It's a signal. It's your body saying something's going on with the prostate, but it does not tell you what that something is. In many cases, it could be benign, and in some cases, it is cancer, but we want to find it when it's still curable and very early. So in a small percentage, it's a type of cancer that actually would need treatment. So who should actually be getting PSA testing? Most guidelines now recommend starting discussions about screening around the age of 45 or earlier if you're higher risk. Higher risk includes men with a family history of prostate cancer, African American men, or certain genetic mutations. The key word here is discussion. PSA screening is not one size fits all. It should be a decision made between you and your doctor based on your personal risk. If you take nothing else from this, remember this one thing. A high PSA does not automatically mean you have prostate cancer. It means you need more information and we need to investigate it further. And the biggest mistake you can make as a patient is either ignoring it completely or panicking too early. The right move is a stepwise approach. Your doctor will likely repeat the test and look for benign causes, possibly use imaging and advanced testing when needed, and then recommend a biopsy when appropriate. Because when you approach PSA the right way, you reduce unnecessary procedures, catch significant cancers early, and avoid treating things that never needed treatment in the first place. So, what questions do you have about your health? Drop them in the comments below and I'll do my best to answer them in a future video. Thanks for watching and I'll see you in the next video.